how did I get started with interest in women's health? I think one of the areas that really interests me is that in women with epilepsy that have, sometimes their seizures are well controlled and they think everything is fine, and then you have to think about the anti-epileptic drugs and the potential effect on the fetus. And to me, that's something that you need to start planning way ahead, and you need to educate early on. And I think that that's part of my role as a physician, is to really start that educational process as early as I can. From the patient perspective, many times stress can seem to be a trigger for seizures. And surprisingly for some patients, to find out that when we do surveys of people with epilepsy, stress is the number one that comes up on trigger surveys. So if you say to somebody, do you have triggers for your seizures? And they say yes, the number one thing that comes up is typically stress. So we don't know, though, how that happens. We don't know, first of all, different people have different ideas about what stress means to them. So, for example, I have a patient who says all the time that whenever his mother-in-law is around, he's really stressed and he has seizures. But another person may say, oh, my house payments are really high and my house is underwater and my job is chancy, and all those things add up to really make my life stressful, and that my seizures have increased in the last year since all those things have happened. So they're two very different things, but they're both stress, and but they're different kinds of stress. So when we ask people about triggers, stress really comes up a lot. I would, in my experience and from some of the data that we have, I would say at least 50% of my patients will say when they're under a lot of stress, they think they have more seizures. So for some people, that stress can be sort of chronic, something like mortgage payments or bad job, and sometimes it can be acute. You know, a loved one dies, or something, you get into a car accident, and just that acute stress may also be a seizure trigger. So there's different ways of thinking about how stress can be a seizure trigger. But what we don't know is exactly why that happens. What does stress do then in the brain to really make a seizure happen? That's something that we don't have much information about, but there is a lot of ongoing research about that now. If a woman believes that seizures are triggered by stress, I think the first thing that she should do is talk to her physician and be screened for psychiatric illness, mostly depression and anxiety. What we found in studies is that people with high levels of anxiety seem to be more susceptible to have seizures triggered by stress. And anxiety can be treated both by psychotherapy or by medication, so it's really an important thing to talk with your doctor about. On the other side, sort of the less medical side, there are a lot of stress reduction programs out there that might help women with epilepsy who believe that their seizures are triggered by stress. Those can be things like mindfulness, progressive muscle relaxation, or even yoga or exercise. Many people feel that just a regular exercise routine can reduce their stress and certainly has usually a positive benefit for seizures.